Let's do it. It was over.
Recording in progress. Hi, Niki. How's it going?
Hi. Good.
Welcome, Dr. Niki Nephin, naturopathic doctor. So you have a focus. I guess we could call it a focus or an interest, a new calling in postpartum conditions. So postpartum anxiety, postpartum depression. Most people probably have heard of postpartum depression more than postpartum anxiety.
Mm-hmm.
And maybe people haven't heard of either, but maybe you could tell us why you decided to focus on this, why it's an interest of yours, and maybe what it is.
Yeah. So it all falls under the umbrella of perinatal mental health, which is just your mental health in the period during, pregnancy, postpartum, and then postpartum is considered up to 1 year by like medical standards, but I consider someone who's had a child to be postpartum forever, because it changes you forever on like not only an emotional, mental level, but also like on a physical level. And I think I came by it really naturally because before I became a naturopath, I was a birth doula. I became a birth doula to support a friend of mine and really got absorbed into the birth world. And by nature of that, like began working with new parents and babies, and then became an ND and had a really strong passion for birth and early parenthood, and then became a parent myself and got real schooled real quick.
And that took the stage of all the educational
it was like a whole other degree, but on, steroids. So I think like my personal story, because, I'm connected to it personally too, is that when I had my first child, so I was pregnant at the end of going to naturopathic college and writing my licensing exams and, doing all the things and like planning a beautiful, calm, like meditative, natural birth at home with my midwives, and then like all the crunchy granola things as a new mom. And, spoiler alert, that didn't happen. And it was like I had been ripped out of my identity, essentially. And what's interesting, as an aside, as like a healthcare provider, someone who works with birth, is that I think sometimes you get your treatment's different. Like they assume that So I think that in lots of ways, it was easy for me to fall through the cracks of the system in terms of like people seeing that I was struggling. I think also like a lot of new parents, because there's so much shame around our experiences and how we're feeling, and there's so much stigma around perinatal mental health, that I was also really good at hiding it. So I just struggled on my own for lots of different reasons that I think a lot of people struggle. I had a difficult birth, and then I had a somewhat difficult recovery after the birth, and lots of stuff going on in my family and personal life that impacted it. And then I also had this wildly, overly attached, fussy baby who wouldn't nurse and who wouldn't sleep, and I had all the things. It was like all of the pieces came together, and so I think I became super interested in perinatal mental health during that time period in an effort to try and figure out what's going on with myself.
Mm-hmm. Yeah. And like you're mentioning the shame piece, and this is something, I guess it can apply, I think, even to nutrition. We have the system in its conventions and its brokenness and how, the ways that it might fail to serve us. And then we have this desire to, let's say, like return to like a healthier, normal space. And so there can be some shame and like, okay, I'm going to go against convention. Like I should have had this like natural hypnobirth where I'm like in a tub of water in my house. And then if that doesn't go well, there's a shame there. Like we see this with people who are struggling with breastfeeding and turn to formula. And they're like, it's like, okay, so the convention before was formula was the best. Everyone should be on it. Breastfeeding's terrible. Then we go back to our natural roots and we say, okay, no, breastfeeding, here's all the benefits. And then if that's not possible for someone, there's this level of shame. And it's like, no, but that's what formula is for. It's for when you can't breastfeed or decide not to, or have a good reason, And so when we have this where you're like, I have this plan, it was going to be this beautiful holistic
Yeah.
experience that didn't happen. Now I feel like I've failed in some way. Like, I don't want to put words in your mouth.
Yes. No, that's exactly what you feel. And, you know, there's a really wonderful Toronto therapist, Olivia Scobie, who wrote a wonderful book called Impossible Parenting, and she really digs into it. I worked with Olivia. I trained with her before as well. And I feel like she really captures that, which is, you're not even aware going into this. This is one of the things. You have no idea what, you know, we prepare to give birth. We go to classes, we listen to things, we do prenatal yoga, we take the vitamins. Maybe you read a little bit about postpartum. Maybe you talk to the public health nurse about like how to bathe your baby, or you read what to expect in the first year. But we do not talk about what that transition from maiden to motherhood, for lack of a better description, is like mentally or emotionally. And it is, the shame piece is like the tip of the iceberg, because underneath all that are these core beliefs about they're like deeply core beliefs about what it means to be a good parent, particularly what it means to be a good mother. I don't want to like discount other people who identify differently, but in particular, there is, so that all of that stuff. And for me, I had no idea that how connected I was before I even had the baby to what my definition of a good mother was. And that's it. That's so important, because it's a huge obstacle to people accessing care. So many people they're not being screened, number one, by their doctors or midwives or whoever they're seeing in their prenatal care. The screening is, and then when they are screened, they're only screened for, you know, in a certain way. There's nothing else. And I think we you know, can talk about where naturopathic medicine comes in there in terms of like our toolbox and our approach is vastly different in that sense. And why people don't get diagnosed or get screened, and then what it looks like when they're getting help. Is that help effective? Is it, you know, what does it look like? And why are so many people struggling? And like, to give you a sense that, you know, in the last 2 years with COVID, I mean, it's it's exactly what you guessed. Like, it's exploded. It's out of control. I would say we are like truly in a mental health, like maternal mental health crisis at this point, because what we've taken away from people is one of the major foundations of good mental health postpartum and in pregnancy is support, right? Social isolation. People aren't having as many appointments with their midwives or OBs. Sometimes they're not even seeing them at all. That could be a whole separate rant, but I think that the number is like, previous to the pandemic, the general number in terms of incidence, like how many people suffer, was like 1 in 7 mothers, right? 1 in 7 birthing parents, I should say.
Which is pretty high, like higher
which
than
is pretty
expect.
high. Yeah. 1 in 3 if you're a person of color or Indigenous. So, and that's society, like systemic issues, systemic racism, etc. And 1 in 10 dads, right? So that I think, to me, that speaks, and there's been some really interesting research, neuroplasticity or oh my gosh, neurology, like I just listened to whatever that word is. You know, a research in dads, right? In partners, I should say, people who aren't the birthing parent, which speaks to sort of the environmental and societal and support piece over the biology. But since COVID, that's been the most recent study suggested up to 33% of birthing parents were at least concerned about their mental health, and about 25% of them had a formal diagnosis or enough of the symptoms, which of course we're talking about, like, doesn't even capture what most people have, because we're also kind of trained or told, if we're told anything about it, that like postpartum, we think postpartum depression just like other depression, like sadness, sleeping all the time, listlessness, maybe suicidal ideation. But in pregnancy and the postpartum period, it can show up a little bit differently. It can show up as like extreme irritation. It can show up as rage, which is really shocking. Someone doesn't tell you that you might want to cut off your partner's head in the first 6 weeks of having a human being with them. that's scary.
Mm-hmm.
You don't know that that's possible if somebody doesn't tell you, right?
Mm-hmm.
And it's so influenced, right? Like it can be, so we need to like understand like, what do those things look like, right? Like, it's not just crying. It's not, and anxiety as well. Like, it's not just necessarily worrying about your baby. It might be like staying up all night inadvertently, like making sure your baby's breathing, which is what happened to me. I didn't even realize I was doing that, but I would literally, she'd be asleep and I would just hold myself in like barely asleep, watching her breathe. Like, is she breathing? Did she breathe? Now, if you don't know about newborns, they do have like a natural sort of sleep apnea. If you're watching all the time, it's scary. And it drives that process over and over again, right? And different things can predispose you to that too. You know, like in my case, I don't start off watching her breathing at night like that, but when she was about a week old, she spit up and she choked, like she aspirated some of that into her lungs, and she stopped breathing for, I don't even know, it wasn't that long. Paramedics, the whole thing. She's fine. I wasn't fine. That was after that, right? So how do we lose parents into the cracks, right? We sometimes lose them because the symptoms aren't what we expect. We're not told what those symptoms are. And frankly, like, people don't have access to their care providers, or if they're not trained to ask beyond questions, like, how are you doing? If you're even asked that,
Do you
right?
think part of it too is like, you know, throughout the process of pregnancy and birth and like the initial postpartum period, so much of the focus is on the health of the fetus baby, and which rightfully so, right? It's a new process, it's a new being coming into life. But what about the person who is gestating and birthing and breast and feeding and, you know, has their own needs, as still a human being, you know, which I think is part of like the doula role, right? It's like somebody there in the birthing process is concerned for the birthing parent, you know. But this is another thing too, is like, to the paramedic, I've just had this, you know, this vision, like paramedics come, your baby's fine, you're like, but there's no paramedic for me or health, like mental health crisis manager who's going to help me process what just happened. You know, there's also that discrepancy where you're like, which often happens with anxiety, right? Where it's like, everything's fine. Why am I still freaking out? And why do I now have these repercussions where I need to check, you know?
It's so you just hit the nail on the head. It is, I liken it to, like, I like to call it like the mother machine, right? It's a little bit of like the, you know, industrial complex system, right? Like the birthing parent is reduced in lots of ways in our system to like a vessel, right? It could be like Margaret Atwood could write another post-apocalyptic novel. You mean Handmaid's Tale, right? Like, you see it. And that is what it's like in a lot of ways, especially in the traditional system of care. And I'm sure even worse in COVID, when it's like stepping back. And yes, even that shift from pregnancy to postpartum. So in late pregnancy, in the third trimester of pregnancy, whether you're with a midwife or an obstetrician, you're seeing that care provider every week. They're checking in on you. They're running blood. You might be getting an ultrasound. They're making plans. Then postpartum happens. And, you know, if you've had a major abdominal surgery to birth your baby, you might be in the hospital for 3 days. 3 days. If not, you're out within 24 hours, less than that with COVID. And they just send you home with a tiny human being. And like, if you're in midwifery care, you're getting visits at home or getting more often visits. I think it's a little bit more parent centered than baby centered. But if you're with an obstetrician, your baby's going in for the baby visits, and they might ask you how you're doing. They might not. It's not. How's the weather? You are literally doing? Dropped off.
Yeah.
Right. And we also don't have, in our culture, we don't have the cultural net that lots of other cultures have, right? We don't live in a village. In fact, you're told now as a mother, you need to build your own village while you're growing an entire human being from 2 cells. Also, please recreate the village that you would have had, whatever, back in pre-industrial revolution. I don't even know, when was the village there?
I was talking
about it was a long time ago
with our friend Erica, who also has 3 kids. And And you know, every single friend I have who has a young child within a year and a half, there's always this strain on their partnership, their relationship, because the role of the birthing parent is so different from and it doesn't matter. These are heterosexual couples. These are
no, it's primary
couples.
parent. It's primary versus secondary
Exactly.
parent. It exists in same-sex relationships.
Yeah,
too.
there's one who's given birth, and so there's this whole hormonal thing, and then there's often like a breastfeeding relationship, and then there's the other parent who in most cases is working, you know, and so that person is working 8 hours a day and coming home tired, and the other parent is like, I just spent all day with, like, 24 hours of my life is with this baby, and I need to like pee without him or her, and can you take him? And then there's always a tension, and we just talk about how, like, for lack of a better word, how unnatural that is, and how it would be like a community of other birthing parents and other infants and babies and children, and someone holds
sometimes
your baby
even those people are feeding your baby. Right? Like in some cultures, it was like whoever was breastfeeding a baby needed to be fed, up they go, right? Like, it's, I like to say, like, and maybe it'll be the title of my book someday, but like the nuclear family is killing us. It absolutely is killing us. It definitely decimates relationships.
Maybe that's why it's called nuclear family.
Again, maybe that's why it's called nuclear. And here's the thing, that's also something nobody told me that. Nobody said to me. So also when you're pregnant, your progesterone is like, it's like something like the hormones in pregnancy are like taking 100 birth control pills a day. That's how many hormones are in your body. All of those hormones evolutionarily are changing your body and your brain towards the evolution of your child being born and surviving. One of those things is that you have a partner. So your brain hormonally in pregnancy, you're flying high on progesterone. You love that person. You love people. Like your attachment centers are on fire, right? What's happening in your brain when you're in late pregnancy and early postpartum is your brain is literally pruning neurons from different areas in your brain and then growing new connections in the areas of attachment and caregiving. That is so that your baby survives in evolution. That's how we are evolutionarily driven, wherever we want to say otherwise. So imagine going from like loving your partner who you've created this baby with, or maybe you've got another partner at the same time, whoever, someone's your person, so much to having a baby, and then that hormone drops within 3 days and then prolactin takes over to encourage body feeding. That is the hugest, by the way, hormonal drop anyone will ever have. There is nothing like that happens in male physiology. There's nothing that happens like that in female physiology, not even menopause, right? That happens in a course of 3 days. You switch from that progesterone, which is like attachment, it like makes you smooth over. You're just like glazed over with love, right? And oxytocin does come in afterwards as well to kind of like help with that. But that switch is so that you stay partnered, so that person can help you take care of that baby so the baby survives. And then after a period of time, like, who knows why that happens really evolutionarily, those hormones switch, right? And now all of a sudden, and maybe this is when in our culture previously in village culture, we would have returned to the group of the other birthers and caregivers, and that person would have gone out to hunt. I don't know, maybe somebody studied that. I don't know. I don't get that deep into it, but there is a switch, and that looks like resentment, rage. There's a negotiation about roles, dividing of work. It's like, it's a very intense time, right? And there's also like layered on all of our own beliefs and ideas about like what we are now, and getting back to who you were before. We're lucky in Canada that we have maternity leaves that are covered. Most people would have some sort of paid leave, but in other countries like the United States, sometimes people are getting 6 weeks. I mean, you're not even physically healed from birth in 6 weeks, and now you're back in the workforce.
And now
it's a lot.
You're detaching from your 6-week-old infant, and your hormones are
it's
like this means that this infant is not like,
it's like a recipe for disaster, right? And so I think when people, like, first of all, there's like the understanding that we don't get that information. People are expected to find that information on their own. It's not spoken about a lot. we spend so much time preparing for the birthing of the baby and so little time preparing for what I would call like the birthing of yourself as a parent, because there is really a death almost of the old self and a rebirth that happens. It actually even see it. I was saying to a friend the other day, there's a moment in labor, and mostly in unmedicated labors, but there is a moment when I feel like symbolically that even happens, right? It's usually transition and it's like, I can't do this. I'm dying. It's never going to work. And then like, as long as things are going well, like boom, usually we have a baby not too long after that, right? It's like the mother,
what you think is your edge. You
yeah,
push through.
It's a sharp edge.
Literally reborn.
You are because your everything changes for you, right? Like your physiology changes. We know your brain changes. We know even your DNA changes during pregnancy because of there's cross pollination, I guess, in some ways, of the baby's DNA with yours, right? So even if and that's true, even if that baby never is born, right? That's from pregnancy. So we are literally changed by growing another human in our body. So we don't go back to who we were in that sense, or in any sense, really. So that's a big part of, I think, something that we don't talk about, that's not addressed in our current medical system. But I think I would even go farther, I would even take it back a few steps, which is like, when somebody comes in and they're struggling, like, how can we get people to talk about what their experience is like, which is the shame and the stigma and this idea that like something's wrong with me if it doesn't feel the way I was shown it was supposed to feel on social media or in movies. Like, how many people are being, posting pictures of themselves raging at their partner in the middle of the night? No one.
Yeah, exactly.
How many? I think I just recently saw a meme that I was like, wow, that's the first time somebody's ever publicly described that. And I'm in a lot of birth community where somebody talked about like overdoing it postpartum and having like a big glob of something like fall out of your vagina while you're talking to someone. Like, that happens postpartum. We don't talk to people about that.
It's just like a beautiful, like it's like a beautiful like mother holding her belly, and there's like sashes blowing on her, these like photos.
No, it's like, look, a really good example is like, look at the beautiful like newborn photos. It's like, I'm just like feeding this baby. I'm in this beautiful like neutral bedroom. Like, my two other children just snuggled up being sweet. They're not screaming their faces off while I'm leaking milk everywhere and bleeding all over the bed with a baby who can't latch because they have a wicked tongue tie. Like, it's I get it. I like the fans. I like the nice pictures too, but I think that it's a real disservice because people come in and it's like, I think it sometimes takes a while for people to realize, and the onus should be on healthcare providers to have the sensitivity and have the, skill, I think, to really get to asking people like how they're doing and what it's like and what they're experiencing. And that sometimes even when people do know something's wrong, like they know, wow, I'm really struggling, I need help, they don't know where to get the help. We don't do a really good job of telling them where to get the help. And sometimes when they go through, maybe their midwife or their doctor at that 6-week visit, when it's like, how are you doing? We have 15 minutes to talk about it. Then they're given like such limited options. And some of those options really don't jive with people too, right? Like my family doctor at one point during that time period had said to me, go on medication. I didn't want to go on medication. I felt really worried about that. And like, I was breastfeeding and my baby wasn't sleeping. And she was like, well, you just need to go on medication, and you should sleep train your baby. And also, you might just need to stop breastfeeding because it really seems like she's just breastfeeding all night and that's why you're not sleeping. So how did that help me? It didn't, because all of those things felt like really outside of what I wanted to do as a parent. I just didn't go back. I just went home, and I, luckily have a community of NDs. I knew that there were other options, right? It still took me like 8 or 9 months before I actually got any help.
And it's not like that those are like bad. Those are 3 options.
Yes.
But the problem is when you're choosing between 3 options and none of them, you know what I mean? Like this is a problem with like some of this very advice-based care where it's like,
Yeah.
here's what you do. And you're like, if that doesn't jive with you, like it'd be nice to be provided with 20 options that you can pick a few of, or even just, yeah, like it's really, and this is the problem, I think, like there's also this part of just like, there's so much to unpack as well. It's more than just advice, right? It's more than just like, okay, you know, it seems like you're up all night breastfeeding. Okay, stop breastfeeding. It's like, oh, okay.
How's that
is
baby
this just like,
fed?
maybe that would be helpful if I just needed permission, or you know what I mean?
Yeah.
But let's unpack this. Like, what is normal? What is, you know, yeah. Like, I'm even just thinking, like, I remember when I was sitting with my friend, and we were with her, like, I think like 2-year-old. No, maybe she was younger, and she was walking around, so maybe like 18 months. And she was like, we're sitting at a cafe, and she's like, you know, you're sitting here talking and you're probably just focused on the conversation and like drinking your coffee. What I'm doing simultaneously while talking to you is that I'm scanning the environment for predators and planning in my brain how I'll grab my daughter and run out of here, where the closest exit is. And she's like, you know, that just kind of like normal, like your brain, like were you talking about that brain change? Yeah. And this is somebody who's very self-aware and like aware of their body, very embodied, and but nobody's really into Instagramming that or describing that. I can imagine mothers or birthing parents just kind of like not really knowing what to make of that, and just maybe that might just, I can see how that new tendency, that neural connection, that new awareness and hypervigilance can then spiral to becoming anxiety. Like part of that is just sort of natural, right? Your brain's changed. Yeah. Now it's not just you. Now, like, you know, if some like predator comes running out of the bushes, like you can escape, you can fight off. Now you have this being that you have to protect from. Your brain has changed. That might be completely natural, like let's say natural, quote unquote, and normal. What's your relationship with that? What's your relationship with these brain changes, with these hormonal changes? And we're going to talk more, like, and unpack more of this, like the social, environmental stuff, like, and also like how there's this, massive discrepancy where you see more people of color who experience postpartum. So obviously there's this massive social influence on that experience. And yeah, like, so it's like this awareness of the experience. No one really is talking about, no healthcare practitioners are like, well, you know, here's some of the changes to expect. It's more like, oh, if you're not sleeping, you know,
well, it's very much just like the rest of the model, right? It's like cause, effect, here's where we can intervene, right? And I think that it's what it really is that it lacks context, right? It lacks nuance. And it assumes that there's a really direct correlation between what's happening, right? And that's right, you know, I'm trying to birth this hashtag, it's not just serotonin. And it's because that's our first line therapy in conventional medicine is antidepressants. And one of the things that I think that is a disservice to new parents is that, first of all, there's a myth that that's the only route, right? And the second myth is that you can't, you know, once you take an antidepressant, then that's it, right? And so what happens is all the people who don't want to take the medication for whatever reason are no longer being treated, right? Are now just left to their own devices. Maybe they get funneled into a group program, but and then they're sure as hell shamed for not doing what they should, right? It's like, well, just take the SSRIs. Like, what's your problem? Why are you not taking it?
You're not.
So is that, and then there's the people who don't actually feel better on the SSRIs, right? Or they feel like 65%, and they're like, well, I guess this is as good as it gets. And let me tell you, every person who has that, because I see a lot of those people, they all come in with the same story and they all attribute it to themselves. It's something about me. I'm doing something wrong. There's something terribly wrong with me because I'm this, and like, I'm a shitty mother, right? And that's where Olivia's book on impossible parenting, and she's like literally doing her PhD now in like this concept of like, what's a good mother? Well, what does a good mother do? She sacrifices herself. She does what's best for her kids. She does all these things. So rooted in the patriarchy and the systems of patriarchy, it's not even funny, right? So when people come to us, when people come to healthcare providers, when you're working with people who are in the childbearing years, it's so critical that we look at that from a truly holistic perspective, which is that there are so many pathways that affect our mental health. It's not a separate entity. It's not like lung health and, you know, gastrointestinal health, right? Like it is inextricably woven into our well-being. Yeah. Our mental health is health. We know that and so what we're looking at is like, first of all, like, you know, I start with like, let's suss it out. Like, is it actually depression and anxiety, or OCD and panic come in there too? Like, what's happening? What are the symptoms? What happened in the birth? Right. The birth and that immediate experience in pregnancy and postpartum are massively affected, will massively affect your mental health. Part of that's probably because our brain is changing. Those hormones and that neuroplasticity is happening to help us be better parents and for our offspring to live. But the flip side of that coin is our brains are like almost, I don't want to say susceptible, but like but because they're changing and they're in flux so much, like there is like increased risk there for trauma in some ways. And so that's like, we know that people whose babies are born prematurely or who have a complication in pregnancy, whose babies end up in the NICU, are at higher risk of postpartum depression and anxiety. We know that people who have had interventions, and you can actually see it increase. The number of interventions in someone's birth is correlated with the increased risk for perinatal mental health issues. It makes sense,
right? Yeah,
like you have to process that. Yeah,
exactly.
And if there's and that is true also on the physical level. So if there are physical issues that happen during birth, there's, you know, a severe tear or like a prolapse or some sort of emergency that happens to the parent during that process, that is also puts you at an increased risk. So like starting off with like, what's actually happening here? What are you experiencing, and how is it happening in your body? And I go through like, and part of this was through my own midwife. She would have this like kind of triage. And so she kind of gave me the basis for this triage. And then I flushed it out into what I would consider like our naturopathic sort of philosophy, which is like, let's look at all the pathways there and all the roots that could be part of that. So it's like, what's happening with sleep, yours and the baby's? What's happening with the support system that you're having in terms of like, and that's physical and mental support in your healing? What's happening in this with the sex hormones? What happened during that transition? What's happening otherwise? What's happening on a systemic level in your body? Is there inflammation? Are there some other things happening? Is there a deficiency happening because maybe you had morning sickness for 6 months of your pregnancy and you couldn't even take your prenatal? Your body just filtered all the nutrients that you got and all the nutrients that were stored in your bones and the rest of your body to that baby, and you're super depleted. And then what's happening with serotonin and neurotransmitters? And so what that does is it opens up the possibility of people getting well to people who are on medication, because, hey, your serotonin is taken care of. Thank you, Zoloft. You're dealing with it. We still have 5 other arenas that we can work in. It also helps us with people who don't want to take medication, which, by the way, is their choice and right. You know, it's like not their fault, right? And we get to choose like, how we heal.
With medication, right? It's like, it's not that this is, again, it's that thing of like, we have the conventional system, then we have like, you know, more of an understanding mental health. And then it's like, you know, people are like, well, so on the one hand, this biological reductionism is what I want to talk about. Biological reductionism is that everything boils down to the one neurotransmitter that's out of whack.
Yeah.
Which, even as we're having this discussion, is a ridiculous thing to say about postpartum anxiety and depression, because that's not the only thing that changes in pregnancy and birth, right? Okay, so we already know that that's a ridiculous assertion. Yeah. I think, you know, there's a bunch of reasons though why it's so sticky a concept and why it's so attractive a concept. First, because if our starting point in talking about mental health was like oh, it's all kind of in your mind, snap out of it. Like it's,
Mm-hmm.
then to find a biological connection is validating and affirming, because now it's not
Yes.
my fault. Like there's something
Yes.
off
It
in my
can be.
brain, right? But the problem is that's not how mental health works. If it was, and then the other problem with it is that, if you take, so it's like, okay, it all boils down to serotonin. So here's the solution. We have this therapy. If you don't want to take it, you're choosing not to get better. There's a stigma that we've
Right.
just already added.
Mm-hmm.
You're like a granola mother. What's wrong with you? If you do take it and you don't get full response, which by the way is like, I don't think I've met anyone that had 100% result with an SSRI. Like there's
Yeah.
always, we call
They're
it
about
like
30% effective.
therapeutic
That's what
gap.
the research suggests. About
Yeah.
30% of people respond to them at all.
30%,
That's
30% of
pretty.
people respond. Yeah.
Yeah.
And some people have, they don't have a clinical effect, which means they don't notice if they get a response. And some people just only get side effects. And there's some research now into genetically who might respond. And so they're trying
Yes.
to just recommend what would
Yeah.
actually work for someone and not even bother. But there's
Yeah.
still so much in that, where some people who have tried and found that it only caused side effects, it didn't produce any
Yeah.
benefit, that they're being told by their doctor to try a different one or to keep trying. And it's like,
Yeah.
the definition of insanity. Not that a different one can't work, but it still brings it to that biological cause.
Meanwhile, that person's just like working on one path, right? Like all of their
Exactly.
eggs are in that basket, right?
Exactly.
None of the other stuff is being dealt with. Maybe if they're lucky, they're funneled into, like in Toronto, you can get funneled into the women's college, postpartum, like perinatal program, which by the way, often has a 6 to 9 month wait list. You time out of it when your baby's 12 months old. And it's really there for people who are in severe crisis. So most people aren't in severe crisis, but they're struggling.
Yeah. And then you have people with the treatment gaps, right? So like, okay, I did this therapy, I get 30% improvement. What about the other 70%? Well, that must be my fault. So we go back to the my fault thing.
My fault.
We don't acknowledge that it's like a variety of factors.
Yes.
Massive ones are social and environmental, like you mentioned. This is obvious. And then you have the pruning, and then we have just because, all the interventions as well, like, which I can imagine, right? Your brain is open and
it's malleable.
Exactly. It's super malleable. And then you're adding these crises, right? Like something's wrong, we're going to do this. And you're like, okay, we need an emergency C-section. Okay. We got to do a blood transfusion. Okay. And you're like, and then in the end, you end up with a healthy baby and you're like, thank goodness.
Yes.
Or then your baby's in NICU, but then it's all okay. And you're like, okay, in the end, everything's fine. So it's the same, like with your story, like everything, my baby's fine, so I should be fine. And nobody is like unpacking this. Yeah.
Talia, nothing pisses me off more than the statement, your baby's fine, you should be happy. Everything turned out fine. And in my own story, like nothing lit a fire under my ass faster than that. It was because the truth was, we also don't acknowledge that there's small t trauma, right? Also don't acknowledge that, like, we think like, okay, if somebody loses their baby, if they have to have an emergency hysterectomy, or if they have to have they have a true emergency C-section where they're put under general anesthesia and they're not even awake for their birth, we will as a society generally acknowledge that was traumatic. But by the way, there's also still a time limit on how long you should have to deal with that, because you should get over it eventually.
You got 2 weeks to grieve, otherwise it's pathological.
Your baby's fine. You're fine. What's wrong with you? This is the underlying thing. What is wrong with you? As if we don't already have that pre-recorded tape in our minds, particularly as mothers, from before, right? Like it's just there. And I think that what we do is we pathologize the struggle. We pathologize it. Something is wrong with you, instead of something is wrong with the system, or something else is wrong in your body that needs help. And I don't want to say wrong. I really like the idea of like, there's a barrier. There's something, there's a block. And this is where naturopathic medicine, this is where we shine, because our toolbox is incredible. We have so many tools, and we are truly brilliant generalists in that sense. It's like we're trained to think that way. It's like, but this and this and that. And if we move this, it's like master dominoing, right? What's going to happen? And so when you're working on all those levels, you don't even necessarily know like what's, you don't necessarily take the time to go, we're going to work only on sleep. We're going to work only on support. No, you're doing it all at once. You're working on many levels at the same time, just moving stuff around, being like, where is it going to hit? Where's the body going to align itself? Where, like, what is going to stick with that person, right? But we actually, like, the thing that I feel like people hear the most is like, in terms of like, well, what are your options, right? It's like, so my doctor was like, sleep, your baby needs to sleep. So let's fast forward 7 years, right? My daughter just started sleeping well this year. You know what the difference was? She had like a crazy tongue tie. How many people did I see in her childhood and infancy who, misdiagnosed that? I came to that conclusion through my own professional like work in working with people with babies, where I was like, and learning from myofunctional therapists and lactation consultants and pediatric dentists and all of these things, to realize that probably a big part, not all of it, but probably a big part of why my daughter didn't sleep, which was causing both of us severe sleep deprivation, was because she couldn't breathe properly, because her tongue wasn't in her mouth properly. It was a straight up functional barrier to her health and mine. And an SSRI was not going to fix that.
Yeah, exactly. Yeah. And dude, I'm 30. I just turned 36, and I just discovered I have a crazy tongue tie that I think
I also have a tongue tie. It's like a problem, right?
Okay, so like 36 years of like weird, like trying to treat weird IBS symptoms. and sleep.
Oh yeah.
And, like, when I was a kid, I mouth breathe. All that. So this is the thing, it's like when we miss
that's only one area too, right? Like that's where I'm like, so that's only one area of like of sleep, right? That doesn't talk about like, what does normal infant sleep biologically look like? And then like, what can you do about it, right? Like what's happening in our brain and in our bodies when we give birth to a baby, and particularly when you're body feeding a baby, how does nature provide the blueprint for us to be able to do that? And then how do we translate that into something that works? And I'm not saying like that you can't sleep train your baby, that you have to bed share or even breastfeed your baby. Absolutely. There's not a set course, but it is context. It's really important context, and it's glossed over as though it means nothing. And the truth is that it can be a lot of things, but sometimes it can be just straight up, your 18-month-old has an iron deficiency, probably because you were iron deficient. And they also might have something going on in their mouth, so they're not up for eating. And so they're not getting enough of their nutrients. Like those things impact those children, and that impacts us. It impacts the whole family system. We have to stop putting the blame on the mother. And I mean, or on the primary caregiver, because it could be, primarily we're talking about like, this is people who are birthing the babies and then primarily taking care of them, who have that pressure, right? It's not evenly divided. So although we do see it in partners and dads, that there's like an increased chance. Like I think that the statistic is, if one partner has postpartum depression or anxiety, the other partner has a 50% increased risk of also having it. So
and you said 1 in 10, right? For the non-birth.
Right.
Yeah.
So
still high. That's 10%.
So that person doesn't have the hormonal changes. So what's going on there? Maybe it's their sleep impacted. Maybe then that speaks to like the environment and the support, right? Not only do we drop people off without the knowledge and the aspect, but like, what kind of support do we have for people learning to feed their babies, right? What kind of support do we have helping people heal from the physical, even just the physical stuff of birth? Like what's, I
mean, like negotiating with your partner, how to have conversations where you can both feel empathy for each other, even if you're not directly experiencing what the other's experiencing.
Do we teach partners how to support, does this in particular, this generation, can we teach the next generation of partners how to support their partners through like those early periods, and how to get support themselves? Who's going to cook for that person? It can be really basic stuff, right? You're lucky if you get a meal train postpartum. That's like winning the lottery.
Yeah.
Right.
Totally.
And again, like back to like everyone, I think, laments and grieves the fact that they don't have this village, but it very quickly spirals into, well, there's something wrong with me, or there's something that I chose. Maybe even people say that to you. Maybe you've got a mother or a mother-in-law who says, well, you moved to the city, so I guess you made your bed and you should lay in it.
Mm-hmm.
That
I
happens
had
too.
no one to support me.
Exactly, right?
Yeah.
I know my mom probably won't listen to this, but I know my mom used to say to me, I just don't understand what's going on with these moms and they don't know how to breastfeed. Like, I just put you to the boob and you figured it out. And I said, so hold on a second. Did you put me to the boob? When did you put me to the boob? In the 10-day hospital stay with nursing around the clock, where someone would help you latch me every day, every feed for 10 days. That was you just putting me to the boob and figuring it out. I doubt it. First of all, like, I just call bullshit. You can't remember that far back. But second of all, like, the support was so different. And like, you know, how many people did I even see breastfeed their babies before I breastfed my own? And keeping in mind, I was a doula and I was interested in birth. Not very many.
Yeah. What were
we're not even exposed to it. Like, how the hell do you,
where only one partner needed to work?
Yeah. Yeah.
And you had your mother as childcare free. Well, and this is the thing, like, I wondered, because I also
and your
have
aunt and your grandmother and your neighbor
like
and
you
your,
had
and
more
your
of a village
sisters
because of like tradition, culture at the time. But I wonder about this too, because when I hear like, and that's another thing, it's like it's often mothers like adding to that shame. And I wonder if that is a projection, a carrying over of their own shame for different reasons, different contexts. There's obviously a difference between our generation and the last generation with its challenges. And like, are they bringing this to us? And now it's like, you know what, you can have my shame. I'm just going to dump it on you. I'm going to get some validation for myself, even though it's kind of not really the way to go about it. And in comparison, and here's an extra load of shame for you. Have fun.
Yeah. Welcome to whammy number 3. What happens when you become a mother to your relationship with your mother or parents, right? So yeah, if all of the ways that you were parented are all of a sudden on the table, right? And I think that that is something that is massively underestimated as driving us to do things differently. And it's certainly used as a source of shame, you know, from like, well, you know, back in the day, we just let our kids go outside. We were fine. You turned out fine. I turned out fine. Everyone's fine, except we're not, right? Except we're not. And I mean, here's the thing. Who wants to be the new first-time mother who says, wow, I really don't like my baby. Wow, I feel like I regret becoming a parent because it's so hard, or like all of a sudden I can't do the things that I used to do, or I don't know who the hell I am anymore because this thing happened, right? Or it's so much harder than I thought it would be, or I'm struggling. It's like we associate struggle with weakness instead of, and I think part of that is like normalizing that becoming a parent is a massive opportunity for transformation, whether you're ready for it or not. And you cannot predict what that's like. I do think we like intuitively, energetically sense that. I actually feel like some of the fear that people have around giving birth, it's been really channeled and focused into like the pain. But the reality is you can get an epidural, you can get a spinal, you can get completely put out if you want. You can check out physically for that experience 100% if you want to. I think that part of what drives that fear is this deep knowing that there is a massive transition about to happen. You cross a threshold, you have no idea what's on the other side, not really. You've often been told lots of crazy, scary stories from other people about the physical experiences, but never enough of the stories of what it was like being the parent and becoming the parent and what it was like. I'm sure our parents certainly didn't tell us what the early days of being parents were like, right? Or if they remember it, if they feel like they can even verbalize what that was like, right? So again, it's not normalized, it's pathologized. The experience is pathologized, which is by nature isolating. It's by nature we go, something must be wrong with me if I feel like I'm not connected to my baby, because the moment I have this baby, I was told that I was supposed to feel this giant wave of love and relief. And the thing is, if somebody is cut you open and rip that baby out one way or another, if somebody's used a vacuum to get that baby out, or if even that baby's come out on its own, but it's been really fast and intense, or even if the birth has been perfectly whatever you expected it to be, not everyone has the same experience physiologically afterwards, and not everyone has, we just aren't all the same.
Yeah.
And so
like, yeah,
we don't
even
talk about the
yeah.
spectrum of experience, and that kind of stuff really, I think, does impact our mental health, because of course shame and stigma do, right? And we don't want to admit to people, even to doctors, we want to say like, I'm a good mom, I'm figuring it out, I'm learning, I'm doing a good job, instead of like, I don't know if I'm doing a good job. I actually don't know. There's no measure here. The measure, and by the way, the stakes are pretty freaking high, because that's an entire human being that you're supposed to be raising and letting off into the world to potentially, you know, do all these great things or become like a serial killer. Right. You know, no pressure.
That's what I was thinking. It's like the serial killer's like, who was the mother?
Don't ever fuck it up.
And the like, as you were even describing this, right? Like the thoughts of like, I don't know if I like my baby, like there's just this extra layer of loneliness that you can just attribute to that, because can those words be, first of all, could a mother or a birthing parent allow those words to even percolate inside their head, let alone speak out loud, let alone bring to a professional? Is the professional just going to be like, oh, you're doing a fine job, don't worry, everybody feels this way, like kind of, you know, here's an SSRI if you know, if you really are feeling you're going through a hard time. But can somebody like unpack that, like normalize that, help you process that? What often happens if we're not allowed to acknowledge these pieces is that they grow, you know, and
they get real loud.
We start to like wonder why, what kind of person am I to have these thoughts? What kind of person am I if I, you know, whereas doesn't Brene Brown talk about this, like something about shining a light on shame dries up when you shine a light on it?
She's like, take it out, put it in, take it out and bring it out in the sunshine, like put a light on it, nothing kills shame faster, right? Just
blurt it out, like, and you know, but it's easier said than done. Like part of it's finding a container where that could even, it could be the container of your own self-compassion and allowing, but it's difficult, right? And again, if there's zero normalization or speaking about these experiences, and they're all just pathologized and reduced biologically to something wrong, it makes it almost impossible. And then and the wounding as well, that like, so you're mentioning the birthing process, and you know, if somebody has had a childhood of trauma, and now you are raising a child, there's nothing more triggering for many people than that.
Oh yeah. You know? Yeah. And so I love that Brene, obviously I'm a big fan. And she also says the caveat to that is people have to earn your vulnerability. You don't just, you know. Yeah. And I think that can be really tricky to manage in the worlds of social media. There is nothing scarier than being in a mom's group. Okay. Like online, a mom's group is like jumping in a tank of sharks. Like you don't even know where they are.
There's like, some sublimated shame right there, right? Yeah. That's
scary as shit. It's like, are you an anti-vaxxer? Are you, oh, you're so pro formula. Oh, you're so pro breastfeeding. Oh, you had a natural birth. I had this, like there. And it's such, I feel like it's such a good example of like, whoa, we are so freaked out and so convinced that there's something wrong, but also like I must appear like there's nothing wrong. That we cannot accept anyone else's experiences or preferences. Like, why would I care if you fed your baby from a bottle? Well, why does that impact me? Like it doesn't. Yeah. But what it does impact is if I'm someone who believes that good mothers only breastfeed their babies, then to prove to myself that that's true, I have to make you believe that. Exactly. So I mean, those things. So what happens there is you become scared to engage. You certainly don't want to throw out there that you don't like your baby or that you hate your husband or that like you're never going to have sex again because you're traumatized by what happened to you in birth or it feels terrible. So it further isolates people into their like, well, I'm just going to have to figure it out. And I'm, while I'm nursing my baby at 3 a.m, I'm going to be Google searching what to do about it. Like, this is not the time for your Google PhD. Okay. Put the phone down, get a professional who can see that, right? Like, you do not need to figure that out. It should not be on your list. And so, yes, do we have containers for that? How can healthcare providers offer that? And are they trauma informed, right?
Yeah.
That is huge. No, most people are not trauma informed, so they can end up re-traumatizing people in that sense too. But it's not just about like, there's the normalizing of those feelings happen, but then there's the kind of like support around, okay, if you don't like your baby, what else is going on here? No, you're not a bad parent. You're somebody who's having a really difficult experience probably. And maybe, that can be a sign of postpartum depression and anxiety. I don't even care what the label is, because to me, the label doesn't matter. It's the experience. The experience dictates the course of action, right? And we're still going to look at it from all the ways. Like, do you hate your baby because your partner works 60 hours a week and your baby screams all night and you can't get them to latch with the breast, so you're bleeding, but you refuse to give a bottle because your mother told you that good mothers only breastfeed, and you can't get to any of the groups and none of your friends have any kids, so you can't talk to anybody about what's happening? And so you hate the baby because the baby is the thing that's causing that? Or is it all the other shit?
Or maybe even, do you just need to grieve your like mom
straight
life?
Up.
Like, do you just
you just need some strategy on how to manage that? And you need some, and 100%, I would say people need community. They need community that they can be vulnerable with and that they can trust. And like, healthcare providers, therapists are part of that. But part of what you're navigating, like when I'm talking about the moms groups, is even people who who you've been friends with for a long time, add a couple babies into the picture. People have different opinions. With my daughter, with the sleep thing, I have lots of my friends who love me and who support me, who were great, wonderful parents, who are like, you just need to let her cry. And I was like, I actually can't do that. I actually can't do that because my own nervous system is so hyperactivated that I just can't tolerate it. And so like, what I needed was for someone to come to me and say, how can we get you other sleep support? How can we get you support for processing your experience? How can we help determine what's happening with your baby in sleep? How can we regulate your nervous system so that you can tolerate a certain amount of crying, which is part of having a baby? How can we figure out what else is happening in your body that might be charging that nervous system up even further, or might be causing some of those symptoms? Because we know in depression, for instance, that there's often inflammation.
And also, like, and this is not necessarily in your case, but another factor that's coming to mind is like, what about your attachment styles? Like, if you had a traumatic upbringing and there was no attachment with your primary caregiver, is there something coming up around that with the baby, right? And now you add the hormones, you add the lack of sleep, you add all of the shame, stigma, lack of community. Is stuff coming up for you that you never, when stuff comes up when you start a romantic relationship in trauma and attachment, is something coming up now that you're a parent?
You see it a lot in toddlerhood too, though. I think like for sure in like the early days too, but I think that the attachment piece really comes out in toddlerhood, when it's in like different,
when you have memories.
It's very fascinating because you can see that the areas and the pieces of parenthood that feel the most sticky are often the areas that your parents had the most stickiness with. It's also the areas that we become really rigid about often, right? So
when
like,
your parents and you're like, oh, now I gotta,
or you're just like trying to not become them. Like, you're like, I will only ever acknowledge emotions. And we're trying to learn. We're trying to learn how to be different and not make the same mistakes. We're going to make mistakes. Nobody tells you that, right?
You're like, well, is the healthy way the opposite way? Or is there something, there's
so much convoluting information out there too, right? And that's when like, it's not the time to get your PhD in Dr. Google of like, what's going on. Like, you need to have, it's sad that we have to build our own village. It's like, let's just call it what it is. It's heartbreaking that that's something that falls on our plate. It's really intense and isolating and tragic when in your time of most need, you might not even be able to turn to the people that you used to be able to turn to, because they're going to be coming at it from a different angle. Maybe they aren't parents and they don't get it, or maybe they're parents and like something happened and they just can't be with you in that experience, right? They can't understand why you're choosing something different, right? And that's why I think people, for lack of anything else to do, turn to just like, well, you're not willing to like do what it takes to get better, or worse, like people are doing everything they can and they still don't feel good. Because it might not be those things, right? Like, it's like, if your thyroid is off, all the sleep in the world isn't going to necessarily fix that. And you know, that is an area that should be standard of care. Like when you go for that 6-week appointment, there is in naturopathic medicine, there's a list. We want to see these measures. How did you do physically from pregnancy and birth? What's your iron like? Did your red blood cells and hemoglobin normalize after losing all of that blood in that process? What's happening with your thyroid? We know that in pregnancy that we have an increased risk of autoimmune disease afterwards. And often that shows up in the thyroid as Hashimoto's thyroiditis. By the way, the symptoms of Hashimoto's are the exact same symptoms of postpartum depression: fatigue, mood swings, problems sleeping, changes in appetite. There's a drug for that. Why aren't they testing for that?
A bioidentical drug. Which is replacement.
So there's those things that are really measurable, and then there's the other things that we know, like, you know, nutrient repletion, all of that stuff, but and reducing inflammation. One of the things that I thought was really fascinating that came out of some of the research about COVID in pregnancy and postpartum, and most of this stuff I'm getting from Rebecca Deckler of Evidence-Based Birth. If you really want to nerd out, she's done an incredible, you know, condensing of the research over the last few years. But we did see, even from the early days of COVID, a real increase in postpartum depression and anxiety, but we also saw a pretty sharp increase in postpartum psychosis. And so postpartum psychosis, the difference between that is like, it's the very severe form. It's like dissociative, there's delusion, there might be hallucination. It's, you know, it's a very serious condition, scary as hell. And those people really do need to, like, often they need to be hospitalized for a short period of time and stabilized. They need a lot of support and can't be taken care of. They can't be a primary caregiver. We saw a real increase of that during COVID, which speaks to, now that we know more about what was happening, the role of inflammation in the brain and mental health. You know, so how can we address that? How can we give people not only that knowledge, but then tools, right? How can we impact that?
It's also like bipolar. So the changes to sleep patterns and daily routines. So like somebody who has bipolar can have a manic episode from crossing time zones, daylight savings time, add on postpartum stress, disrupted sleep. And this is very, very common, is mothers or birthing parents who have bipolar and maybe had it before giving birth have are triggered. Their manic episodes are triggered. And being able to be aware of that, to access extra support, to be able to talk to your psychiatrist about that ND, right? That's all important. Like how this process affects your mental health in general, whether you have a predisposing condition or not, you know?
Yeah. And knowing that, right? Like knowing that, like, what are the risk factors, right? Like, you know, a previous history of any mental health issues, right? Any sort of excess stress that's happening during the perinatal period. Do you lose one of your parents during that time? Do your partner lose their job? Is there excess, in particular, is there excess relationship stress between you and the other partner? What's happening in terms of your housing, in terms of finances, you know, and then like what's happening in your body? Did you have gestational diabetes? whatever, right?
Yeah.
And then we bring into like, what happens during the birth? What happens to the baby afterwards? Did you have issues with feeding? What kind of support did you have? So there's so many different things. And yes, knowing that going in. Also, like, did you have a previous experience? So I knew going into having my second and third child, oh, hey, I'm at higher risk for this. And all of those pregnancies and all of those postpartums were different. And I definitely had struggles in all of them, but in slightly different ways. And that's even knowing it. Like, that's where I think we come back to, like, it's not knowing it and then being like, well, now I know, and I've done all these things and it's not going to happen to me. It's like, this might happen. There's a good chance some form of this is going to happen. What's normal, quote unquote.
And that's
what's
thing, like,
tolerable for you, because sometimes what's normal is not tolerable, right?
Yeah.
Or, and can we use it like not only as an opportunity for healing because you deserve to feel better, but because that experience, there's so much opportunity there. Like, I feel like it's such an untapped source of power. Like, when people, nothing drives you to want to change the world more than when you bring a person into it. Like, I don't want my daughter or my sons, for that matter, to go through that. And that's like, for me, like, I obviously have a strong personal attachment to it because I want people to have what I didn't have. I want them to be able to access it easier. I don't want them to go into a specialist's office and be told there's nothing wrong with you except for that you're a mom, as though being a mom is a diagnosis. And also, like, you haven't lost your baby weight yet, so probably that's why your joints hurt. Like, GFY, lady. Wow. What? Yeah. How dare you even say that to me? Yeah. Which is, by the way, what I said to her. I was like, you, what are you talking about? Like, so funny, what is, like, the working diagnosis here? Like, run the fucking blood work.
That should be the title of your book.
You crossed the wrong mama.
Yeah. It's so funny. Like, every time I go to a conference, and we always talk about, like, the shaming in like weight shame and body stigma. And I'm always thinking, like, as we're talking about it, I'm always thinking, like, who is experiencing that? Like, does anybody really go to their doctor? Their doctor just tells them, like, oh, your problems are because you haven't lost. But it literally is happening all the time.
And it can be super subtle, right?
Yeah.
It can be super subtle. It's like, it can be subtle in ways that's like I said, like, just, okay, so we know, and this is where I'm like, people trying in ways to like integrate other quote unquote alternative stuff. It's like, so exercise would be really good. It can really impact your mood. It's like, yeah, I can't get out of bed in the morning when my baby's screaming. Okay. So I'm not getting up and running 6 miles. Some people will do that. Some people that can help with, it can help, right? It does help. We know that endorphins, exercise does feel better. But, like we were talking about before, you start with standing on your balcony or your porch or in your front door with the screaming baby, with your face in the air. And that's how you start, right? Like, let's break it down into what people can actually do. Don't send them away with a prescription that they're not going to fill and some advice that they won't follow, knowing that they won't follow it. And it needs to be people. I think that's where the context and the nuance is, like, what's happening for you? How can we impact it on all those levels? How can we work on all of those different pathways that lead to good mental health? And how can we break it down into steps that are manageable? And sometimes when I have people come see me, I say to them, where are you on this line in terms of your capacity? Because one of the things that's really difficult about depression or anxiety is that what you need is capacity to get better. And what you lack is capacity. So sometimes you need a flotation device. And that's where I think sometimes medication can be good for people. It can be the cheapest, fastest, easiest way to a flotation device. And that's why I say to people, it's not mutually exclusive. You can be on the meds and we can still work on the root cause. Because guess what? That just takes care of serotonin. Or it can be, if you don't want to be on the meds, then we can do all the other stuff, but we might have to do it in a different way. And we might have to slow our pace. We might have to make it super baby steps until you start to feel better and there's momentum for your capacity to build to feel better. that's the other thing. Like we don't think that we don't give people what the trajectory looks like. And, you know, that I'm sure you've seen that meme where it's like what we think healing looks like and what it really looks like, right? It's a squiggly, messy, that's what healing looks like. It's also what parenting looks like.
Yeah.
And tell you, nobody told me that it was going to be that chaotic forever.
Yeah.
So some of it's just like, you know, sometimes it's just like, how can we support you? Like, what can you do? What do you want to be able to do? How can we make it easy and achievable for you? And who else can help you? Because it's not just you. Your community is medicine, right? Yeah. It's the kind of medicine that we lack and the most, right? And that's, you know, it's like how can we make it work in the system that we're in? Like, sure, we want to get you fired up, we want to get you feeling better so that you can raise these beautiful children into the world to change it, but also so that we can get you fired up as a human being for whatever reason you're here to do, whatever work you're here to do, right? And some of that might be around changing some of the systems. I think that, like, I see that a lot in this generation of parents. Like, here, they're cycle breakers. They are passionate. But they're also exhausted and not supported and depleted and inflamed and all of those things. So, like, you know, we have to feel better if we want to do that work. We want to do the work to change the world, I guess, right? However we're doing it.
Yeah, we always talk about, like, with naturopathic medicine, the root cause, and it makes it seem almost like there's one, but I think this, like, the concept, like you're saying, like finding the context, unpacking, but this idea
there's many roots,
like unraveling the yarn, because you can, like, even here in the, like, there's going to be probably more than one conversation to understand the problem, all the aspects of it, to understand how to start, what threads to start tugging at, and where we want to end up. Maybe we don't even know until we start
what works
better.
No,
exactly. Like, what I've noticed is when I've seen patients multiple times, and sometimes I'm like, I don't really know I don't have as much of a plan for this patient. And then we end up in a conversation where we happen upon a concept and we go deep with it.
Yeah.
And we discover, okay, that's sort of where we need to start. What are some of the obstacles we can foresee that might, like, you know, like, go for a run. It's like, okay, first of all, I think that's too stressful.
Or take St. John's wort, right? Like, people are like, exactly. Okay, we'll just like take some St. John's wort.
Going for a run, I think, is probably like too much. It's like saying, like, okay, go on like a low calorie diet, have fun. That's gonna be great for everything. It's like, no, let's start moving energy. How might we start doing that? What do you think about 10 minutes of yoga or stretching or standing on the porch? Like, let's talk about this. But also, I'm not you. And what's really going to teach us is, you know, is when we meet again and discover that it didn't work for you at all.
What did work? What didn't work?
Exactly. There was a massive obstacle that we had no idea, neither of us knew was going to show up. Like,
because you didn't see it, you had to uncover it, right?
Exactly. Yeah. Like, if you're like, well, I can't get out of bed, and then we discover that actually is you can't, then where do we go from there? Yeah. And
now what? Like, then
exactly.
What? Yeah. It's not a prescribed course, right? And also, I think, like, here's to toot the naturopathic medicine horn. Like, I'm not some all-knowing God with a, you know, crystal ball.
And why would you want to
But
be?
what I am is someone who's no. I am someone who is curious and compassionate, and I like looking at patterns, and I like tugging and seeing where things move. And I'm someone who can listen. And I'm someone who really cares and believes that, like, you as the person, that actually the biggest healing is you figuring it out. My job is to give you the resources and to guide you and to help facilitate that process, right? Like, to have a continuous source of space and support and ideas. You know what I mean? Like, it is a partnership. And when I'm working with my patients, that's exactly what I'm doing. And it's also why I feel okay to say, like, I have these things happen to me. I still have those things happening. It doesn't mean I can't be a great mom and a great doctor and a loving wife and like a good community citizen. Like, it's not what we think it is. It's not, you know, a cross to bear. It's part of us. Like, you know, we could get into like parts therapy, right? Like, it is a piece of me. I say to people often going into labor, fear gets to be in the car. It's not in the driver's seat. Depression, anxiety, an activated nervous system, whatever it is that's part of like what's driving your mental health is in the car. It, you know, it doesn't need to drive who you are or what you're doing all the time. And when it is driving what you're doing or how you're feeling or it's taking over, that's when we need to like rein it back in, right? So it's the person's job, like that's the circle of care, and the community piece is like, how can we distribute that load and help you carry it and figure out what to do with it, right? I know I really was always really interested in when you were talking about like narrative medicine. And I think that this applies to this stage of life and these experiences so much, because that's such a big part of our story, right? Is going through these experiences, whatever parts we experience, and like, how do we weave meaning into that? Because they're coming with us, right? You don't get to change your mind. Right. Like, sorry,
go back in there.
My mind. Opting out now. Maybe we would if we knew what it was like.
And this, like, you know, because so throughout this conversation, I'm like, should we, in my head, I'm like, should we like go over the symptoms now that we're like an hour and a half in of postpartum depression, anxiety? But I think that what I really like is this distinction. Well, you know, we can say what's normal, what's tolerable. But you know, even like meta to that, more
specific.
Because, I see, like, as a mental health ND, I see the benefit of diagnoses and talking about them and understanding what someone's diagnosis is and how we can use that to guide us in decision making and finding tools that help. And then going under that to understand what some of the factors are, how we can peruse the literature, etc. It's nice to label things. We like to label things as humans. And you have labels, and then you have the weaving of narrative. And you mentioned narrative medicine, narrative therapy. And it's like, do you have to have a diagnosis? Like, I don't know if in your story, if you got a diagnosis, it sounded like your doctor was like, you're fine, sleep.
Was it communicated?
And so, like, how do we weave and understand and connect? Like, you know, I'm just thinking of a conversation I had with a pregnant patient who was experiencing a lot of anxiety over eating the wrong thing and not being able to take supplements because of morning sickness, etc., which is super common. And I always remember one of our colleagues, and I always tell this story if anyone's bringing that up with me, I'm always like, because my focus is not pregnancy, but I'm always like, one of our colleagues, like one of our mentors, told us in our class one year, I think it was first year, that all she had for her entire first trimester were quarter pounders with cheese. And I'm like, Lord, our kids are functional and everybody's fine. I'm like, so there is this, right? Like, you definitely have this like biological buffer zone where you don't have to be perfectly. But unpacking, like, that's not necessarily something we have to diagnose or pathologize. Like, we can just talk about it. We can understand where that's coming from. We can connect it to other worries that this person may have. Like, there's a lot there, right? Like, the conversation led us to talking about work and what that will look like after the baby's born, and etc. And making decisions, trying to get a midwife during COVID, which was another massive issue. And it's, it doesn't necessarily need to be a diagnosis. We can work with things as they are.
Diagnosis can, can it be helpful? Like, it depends. Like, it depends. Is it helpful? Who is it helpful for? Right. Like, but I think, like, in terms of symptoms, like what it looks like, I think that you're right. Like, differentiating between, like, what's the difference between, like, when are you tipping over? And so the first thing I would say is, well, that tipping point to me is individual. It's like, well, it's when do you feel like you're tipping over into something? When do you not feel well? When do you feel like it's a lot harder than you thought it should be? Because that means you need support, whether or not you have anxiety or depression or whatever, right? But in terms of like the actual clinical diagnosis, obviously most people would use the Edinburgh postnatal depression scale, which you can Google.
Mm-hmm.
It's very generalized. I don't think it captures most people, right? It can, and it, because the reason why it doesn't is because it talks about like on a scale of 1 to 4, 0 being none, 4 being like almost all the time. It's like, are you crying all the time? Are you having thoughts of hurting yourself or the baby? Are you like losing interest in things that you previously had interest in? That one I particularly take offense to, because I'm like, yeah, what's the difference between losing interest and having no time?
Right.
Right?
Yeah, you're like, it
or,
helps
or
me
like,
to
are you
not be
socially
interested
isolated
anymore.
because of a pandemic, or because your baby screams, or because you're having trouble breastfeeding, so you are afraid to feed your baby in public, but you're also worried about giving them a bottle? Like, there's so much context there. But in terms of like, actually, like, it's like, are you having like, you know, is your sleep disrupted? Are you sleeping all the time, or are you sleeping none of the time and like up writing a manifesto, right? Are you eating so much that you feel sick, or are you not eating at all? And so like, there's another example of like, there's nuance there. Are you not eating because you're hyper focused on taking care of the baby and there's no food and you don't know how to feed yourself and there's no way to get out to get food and no one leaves you food? Like, it's, there can be so many reasons, but like the actual, you know, are you having flashbacks or like to experiences during the birth and labor? That's another one that I don't think that's on the scale, but that's one that I would add to it. And I would also add, like, are you ruminating in thoughts about like whether you're being a good parent? And like the anxiety too can be, the hypervigilance is really tricky, because of course it's natural for you when you first have a baby, you are hyper aware of that baby because you're learning the baby's cues. You're learning. So like with my first baby, someone said to me, well, you'll hear the difference in her cry between hunger, tiredness, scared. No, I couldn't hear anything. It was like panic. Everything was panic. But with my second child and my third child, I could. Some of that's temperament. So the first one is like, it is panic no matter what. It's panic if a tooth is coming out. It's panic if something bad's happening. The second one was like, there's no problems.
Yeah.
I will only cry when there's a very serious thing happening, which by the way is almost never. Right. So like, it's temperament too. But so like, are you, intrusive thoughts might be is another example of like, not on the scale, but is really part of our diagnosis for postpartum anxiety. It's like, are you holding the baby and about to walk down the stairs and then having a thought of like, I'm going to drop the baby, or like, I'm accidentally going to drop the baby down the stairs, and it's just your mind saying, do you know how to go down the stairs with the baby? Because you've never gone down the stairs with the baby before. So I'm not sure that you know how to do that yet. So like, and there are skills that we can help people build to deal with those things as well, right? I also would put in there like that some other more subtle symptoms might be things like refusing help, like refusing letting anyone else hold your baby, or feeling super worried or scared about leaving the baby with even their other parent, or like people that you really trust, can sometimes be like signs that things are tipping over into an area where you're struggling more than you need to. Right. And definitely shame and guilt, like having thoughts of like, I'm a bad parent, or, you know, and the more serious things like, I can't take this anymore, you know, suicidal ideation, which is often, again, like people don't talk about it, but can be really common. And to me, that's a sign that like, you're out of your window of tolerance now. You can't tolerate the feelings that are coming up or the input that's happening. And so you're looking for an escape. What you might just need is like 5 minutes in the bathroom by yourself.
Yeah.
You know, and one of the things that someone said to me in parenthood that like, again, blew my mind, and that I really felt like I didn't want to do, but sometimes had to do, was like, if you really feel freaked out, it is safer for you to put your crying baby in the crib and step outside. Your baby is safe in the crib. They are not going to die. They're going to be upset for sure, but it's better than you being super dysregulated, holding a baby, freaking out. Like, go take a minute and just get back in your body.
Yeah.
You know? And so those are some of the symptoms like that would come up. Like sometimes there's physical symptoms, obviously fatigue, there can be pain, there can be digestive upset. I think people know when something's happening, that when they don't feel good, and whether or not that's like, I don't care about the pathology. To me, I'm like, do you have postpartum depression or not? Are you having what would be considered a normal amount of struggle transitioning to being a parent? To me, that's normal. It still warrants support. It still warrants help. There's still tons that we can do, you know?
Yeah. And like,
we might not fix it all, but like we can work on it. We can help you get better, right?
And when you don't have the village, right? Like this lack of village, and maybe just the reality of that, it's like, is it not normal then to feel like you're not enough? Like then we have to kind of normalize that to every parent in the nuclear family who's going to feel like they're not enough. And how do we work with that? You know, like, can we bring that into the conversation? Because like there could be all of these symptoms, and then there may be just these narratives that run through almost every parent's experience, just because of the deprivation of these, like maybe more these social needs that we have, that very few of us have.
And it's like, they're not separate, right? Like it's like the social environmental support needs can't be divorced from the physical needs, from the emotional mental needs. Like they're all really, really complexly woven together, right? Like, and I think that it's the same as when we're dealing with other stuff in the body, that like it seems like this tangled mess, which is really overwhelming. It's really overwhelming, especially if you're the person experiencing it and you're trying to untangle it yourself. It's not just about the knowledge, right? If it was about the knowledge, then people wouldn't, it's like, you can get the knowledge. It's about the strategy, right? It's about, where do you start and how do you know if it's working and what do you do next? What else can we layer on? And it's like, it's that overwhelm is like, I think that's really truly like the saddest part about not having the village, is also that people aren't with you in those experiences to normalize them, but also just to see how you're doing. Because it's hard for us to even necessarily know how we're doing, especially if we're not in context of what's happening with other people. We're not necessarily seeing what it looks like because people aren't portraying it for real, right? Like, how many people would ever say to me, yeah, I really freaked out at my partner and like screamed at him last night and like threw a glass at the wall or whatever. Like, nobody's telling you that. How often is that happening? More often than you think.
Yeah.
You don't tell anyone that that's happening. Nobody can give you tools to help deal with that. It's a lot of pressure. I think that there's also like, there's a lot of pressure on that partner to figure it out too. And like, you're drowning, right? It's easy for people to drown. So it's like, that's why I think that concept of like impossible parenting really resonates, because the systems don't exist there, right? We don't have the systems, and we always want a framework really for how to deal with it. But with everyone, it's sort of slightly different, right? It's just individual, right? And it's also like, it's so tied. I think one of the reasons why it's tough too is like, it's tied to that stigma piece, right?
Wouldn't it be great if like the birth mother influencers called their professional photographer over when they're throwing glass?
Yeah, right.
Quick, like we need the photo shoot to happen so we can actually, like, I'll acknowledge your Instagram is quite real, and you have a lot of good shares on your story that are very just like, let's talk from these different angles. Let's just say the things we don't normally say. Like, let's just blurt out the things we're not supposed to.
I'm a bit of a blurter. It's true.
Which is great.
You know, it's like, that's just like who I am, right? And that's who I've always been. And for me, like, I was just like, I care more about other people seeing that that's okay than I care about what I look like. I don't know. it's, for me, it's been just such an experience of like, it's just been so transformative for me on so many levels. I feel like for my story, it feels like part of why I went through that was to be here. Right. And I really, I just feel really passionate about people going through, like, you know, helping people go through that. Right. And just like normalizing it and changing the way that we look at it. Cause I really feel like that is a huge impact on the way that our world works. Right. Like we raise these humans and they go off into the world and they become leaders and artists and innovators. And, you know, there's so much pressure to get it right in that sense, but there's like, we also raise ourselves in that process, right? Like we heal ourselves. I really love that idea that comes from indigenous, like ancestral knowledge that like the 7 generations ahead and the 7 generations behind, which I learned from Asha Frost, who's like just wrote a beautiful book called You Are the Medicine. Oh my gosh. Yeah. Read it. It's so beautiful. And it's so,
I pre-ordered it. I was like, I really want to read it.
Asha's like, she's been a mentor to me. I've learned so much about stepping into my own story and my own medicine from her. I will be forever grateful. And she shares so much of that in her book. And I really believe that. Like, I think that we all carry just a gift that we bring to the world, and we need to be able to give it. And part of it is that we can set up the systems and the support people to be able to do that. And it happens, like you said, like a tree doesn't have one root. There's so many. So, you know, we can work on the systemic stuff and we can work on the biological stuff. And we can work on the mental, emotional stuff. And we can, I do think that we can change the way that people parent and the way that we experience parenthood.
Yeah, this is beautiful. Yeah. And I know like you were always into babies and birth, like even like at school. Yeah. I think I remember we were at like our Frosh, whatever that was called, Unity Summit. And I remember sitting at a table with you and hearing you were like talking about it then on our first week of school. And so it's great to see this evolution, to see like, we don't, you know, what was it? Oh my gosh. I was listening to this audio series by a psychoanalyst, Francis Weller.
I love Francis Weller.
So good. Yeah, it's worth anyone that wants to get. It's like an 8-part, I think, series, $100, but really, really good. And he's like, you know, our wounds are also our greatest, like our deepest wound is our greatest gift. And we never, you know, and there's the acquired wounds and the required wounds. And, you know, it's like you can, again, you don't want to put that on anyone's story to be like, good thing you experienced that because now here you are. It's good for me, you know, but this is like, when we alchemize that into, I want to use this to help other people and to learn and to understand what happened to me, like it's happening to others. Even this concept, like this vulnerability, this authenticity that you have, right? So you're like this blurting out thing, you know, it's like, there's obviously like a courage and vulnerability in that. And you're like, when I blurt, you know, I'm going to resonate. Chances are I'll resonate with a ton of people who aren't hearing this message. And I'll probably also, you know, make a lot of people like not like
feel uncomfortable.
Exactly. Feel uncomfortable. And is that just their, you know, subversion of their wound? And maybe they just need to hear it anyways. And so, you know, we need to, there is this, and
people can't
conversations.
I was gonna say people can't alchemize, whatever that word.
I don't even know if I used it properly.
I think you did, but they can't integrate that story into their life and into their purpose and all that stuff if they feel like shit. Right? Like you're not
still in it. Like, you're not teaching about
depression and I'm like writing my story and changing the world. No, you're struggling to survive.
And your wound is oozing and bleeding.
Like it's I think, you know, sometimes that can be a nice carrot to dangle, right? I know, like, and I definitely went through therapy when I was going through this. A lot of that was so helpful for me. And she used to say to me, you know, think about Brene Brown when she wrote her first book. And I think it was Rising Strong that she wrote when she was talking about my nervous breakdown / like, you know, awakening, right? She's like, when it gets hard, when the slog is like really difficult and you're in it and it feels like it's never going to end, think about, like, you can think about that there is a purpose and there is a meaning, or there could be a purpose and a meaning to this at the end, and that can help motivate you. But I think that, but I would take it one step further to say, like, then let's work on the other levels. Like the mental, emotional, purpose-driven piece of it is there, but also you might just need to get your baby's tongue tie clipped.
Yeah.
Or you might need to like take some selenium for your thyroid. Or you might need to eat a bunch of protein in the morning because your blood sugar needs to be regulated, and you don't have the building blocks to build the hormones and all of the other pieces. Like, it doesn't have to be, for people who will be scared off by this conversation becoming extremely woo and spiritual. Sorry, it doesn't have to be that, right?
Yeah,
like
you can always just go back to protein if that's the only takeaway.
Yeah, you can just, like, let's just go back to, like I said, like basic bitch, right?
Yeah.
You can go back to like what nutrition, sleep, whatever, but those things can be, I think it's having access to a greater, deeper understanding of all the ways that we can impact that, right? Yeah. And so sleep is not just like, you have more options than sleep training. You have like understanding what normal infant sleep is, learning how to sleep bank, getting support for sleep, night doulas, dealing with anxiety you might be keeping up at night. It might be learning how to bed share. It might be, using herbs or supplements to encourage sleep. It might be having a conversation with the fair play deck with your partner about like dividing roles in parenting, because guess what? Your husband can night parent too, even if you breastfeed. So it's like, it's fleshing it out, right? Yeah. It's fleshing it out, and it's like, and it's so contextual to that person. But
there's no like, recipe book, let's say.
There isn't. And that's why I think choosing people to be a part of your circle of care is really important. Like your obstetrician, your midwife, your, lactation consultants, pelvic floor physiotherapists. I'm not an expert in everything, but I can connect you to an expert in just about everything, right? Like getting a therapist who you drive with. Or maybe you're doing like a group thing, or maybe it's figuring out like which friends you can talk to and opening that conversation. Sometimes, people are scared to say what's happening to them, but when they do with the right people, it's like, oh, me too. That's happening for me too. And sometimes, honestly, that can go a long way. It's just like, oh, wow, that was hard for you. I will never forget a patient of mine who were talking about this. And I think this was like when I was first like coming around to like sharing my own experiences. And I had a bad experience with a colleague of ours at like a gathering. And I was really struggling after my son, Woody. And we were in this like group sharing circle. And I was like, it's really hard when I see people who are in the same situation as me, not to like share that I've been there, because sometimes I feel so moved by their story that I want to just tell them, like, I want to connect like as a human being. And like, I don't know where the line is. Right. And, a bunch of the colleagues were talking about like how we dance on that line all the time. Right. We're human beings.
Therapist self-disclosure,
and then one
PSD.
Yeah. Right. Then one person was like, oh no, that is crossing a line. That is bad. That takes over the process. It refocuses to you, blah, blah, blah. And I was like, oh my God, like, okay, I shouldn't do that. So how do I show up as that person? Right. And what changed it for me was I was talking to this patient of mine, and she was talking about it. And she said, like, I just see someone like you. And I'm like, how come I can't just be X, Y, and Z? And I was like, oh no, it stops here. I'm like, no, you don't know me. Like, you don't know me. You don't know the experiences, like, and because you don't know me because I haven't shown you. And it's not that you need to know every thought and personal experience, but you do need to see me as a human being and as a parent who's in the process of actively growing and changing. And that liberates you to do that. Right. And there is, yes, of course, a fine line of disclosure and recentering, but there is like then that's how we build the community too. And I think that that's a real difference between our medicine and conventional medicine too, is like, it's not authoritarian. It's not, you know, it's like, it's a collective effort, right? It's a facilitative relationship, but
patient-centered, all the good,
yeah,
all the words.
all the good words, but
yeah, it's, I mean, you know, so if you're like, okay, I have to be a Freudian blank slate where I don't even emote, I just sit there and receive the story, then now you're going to be a projection of somebody's insecurities. So now you're the perfect parent to this patient, and you're like, well, me sharing a little bit could help you just to like, and you know, psychoeducation, like normalization is so powerful. Normalization is very, very powerful.
Maybe that's social media's, you know? Maybe that is the backhanded gift of social media.
Yeah,
certainly
exactly.
there's lots of problems with it, and I think it drives a lot of, again, like promoting, especially in that way, this sense of perfection, right? It's like all the beautiful pictures, right?
Or the I made it-itis or something. My friend calls it this, where we tell our story of like, you know, I had this really horrible experience and now I'm on the other side of it. And here I am to guide you through the valley of death. To guide
you through it. Yeah.
And no, you know, because that's not how it works. You know, nobody's
it's a lot more dynamic, isn't
it? Without a scar, right? Like,
right. Well, and Brene talks about that too, but right, like sharing the grit as it's happening, and we're all just learning, right? Who was it said we're all just walking each other home? Like that always resonates for me. Ram does. Okay. You know, like we are all, I hate that the pandemic stole my tagline of we're all in this together, because now it's ruined forever, but it's true. Like we are, right. It's like, yes, we're like, but it is really true. Like we are all in this experience together, one way or another, parents, not parents, everyone, like we're all, and we all have mental health, and we all need support and deserve support. I think that's the other thing. And I think that like the message I'm trying to get across is like, we can get better, and there's not just like one way to do it, right? And behind that is like, you deserve to get better. You deserve to feel well and be supported, because often there's that underlying belief system that like you said, that there's something that feels like there's something wrong with me, there's something, I'm not good enough, right? And that translates, I think, into like the way we show up in the rest of our lives. It translates to how we show up for other people too. So
and this is Francis Weller, he's like, there's 3 things we do with our wounds. We conclude, I'm bad, I'm guilty, like it's my fault, and I'm being punished. And he's like, you know, the wounding is inevitable. We're not, none of us are going to get through this without any scars. And, you know, and some obviously have it rougher than others, but when we start to draw conclusions, we add this layer, right, of, you know, something's wrong with me. And it's an unfortunate thing to add, because, you know, this is, it's happening. Like you said, just those statistics should tell us something, right? 1 in 7, 1 in 3, 1 in 10. That's like a large proportion of people. Like if you're at a mom's group and there's 10 people in that group, chances are at least one is dealing with something.
And like I said, with COVID, like it's looking more like 1 in 4, like it's literally doubled. So, and that is, by the way, people who are disclosing that, right? Because those are Stats Canada. That's someone who's disclosed that to a healthcare provider, not, you know, I think the COVID statistic was on a survey. So, you know, that may be a little bit higher, maybe a little more realistic than maybe it was always that.
Yeah, right? Totally. Yeah. Now they're paying more attention. And and then you think of those like online Facebook mom groups and all of the, and so you're like, okay, you know, 1 in 4 of these parents might be dealing with something pretty, you know, hard. And so, I
think that might speak to then, like, yes, like when do we tip over into it being pathology, and like, and again, like, does that matter, or does it matter, like, you know, I guess the line for some people would be like functioning, right? Like when their functioning is impacted, when their parenting is impacted, and that might be different for different people. But to me, it's like, how do you feel?
Yeah.
You know, like, yeah, you're going to be tired when you have a newborn. Like, it takes a while to adjust to that sleep pattern. It's an intense learning curve. But how do you feel overall about what's happening and what your experience is like? And can you ride the waves, right? Like, can you, it's not, you know, it's, that's the other thing. It's not like a destination, be like, and now I'm fine. And now parenting is easy. And now that's not how it works. You know, you got to learn to surf.
Yeah, exactly. There's never a moment in surfing, right? Like it's just a continuous.
Maybe that's why I'm terrified experience of surfing, Talia. It's too close to home.
It's too metaphorical. It's literally a metaphor for everything. Before I even surfed, I was watching it being like, this is really like, just watching people try and get out past all the whitewater. I was like, this is a metaphor for the struggle, like the tenacity and
the struggle is real.
It really is. And then when you start adding in wipeouts, now you have a whole other, you can really figure a lot out when you're surfing about yourself too. You're like, oh, I
bet.
Yeah, but this is it. It's like,
it's a whole other podcast.
But you can
surf
learn to
as a metaphor.
Yeah.
You should
when it's overwhelming and you have to go in and you're like, I can't be out here. It's too much. And then, you know, and then extend that metaphor to life. And then maybe you need a break or help, you know? And when you're feeling like that.
How do you feel? What do you need? Right. That's like our family tagline is, say what you feel, ask for what you need. You know, it's not working super well yet, but I'm going to stick with it. I'm confident it's going to take eventually.
That's actually that's really good. That's like kind of nonviolent communication, right? It's like, I'm owning my own feelings.
Say what you're feeling. Like, what are you feeling? And how do we, you know, what do you need? Just tell me, you know, it doesn't work with the toddler.
That you aren't letting me have a cookie.
Yeah.
Like, okay, sounds like you're feeling frustrated that you need a snack. I don't know if it's a cookie, but
the hanger. Oh boy, the hanger. Blood sugar regulation is important for everyone.
Yeah, this is for the listeners that check out, if you haven't been exposed to some of my content, blood sugar regulations, like
huge.
You know, if we could fix that, if that was something we could put in the drinking water, we'd probably have a lot less business.
Yes, probably. Well, and so that's the thing that I think is like as another like good takeaway piece, right? Which is like, they're in the age of so much information, social media, Google, books, groups, courses. It's not the lack of information, it's the lack of strategy about what to do with it. And when you are drowning, you don't Google how to swim. You call for help, you get a flotation device, you go take swimming lessons or whatever it is, right? Like you get the help and support, right? So it's like, and for some reason that doesn't translate into parenting for us. Like, we don't see that connection, that it's like, you shouldn't be responsible for figuring out how to get better on your own. This is not like a DIY project. Wait, DIY? Sorry, I have dyslexia around acronyms.
Yeah, exactly.
And that was a huge, you know, like that was a huge learning for me personally too, because I come from a family of extreme do-it-yourselfers. So like it was it is, you know, it's probably partly why I'm an entrepreneur. Like I like that. It drives me, but it doesn't apply to like early postpartum, right? You don't have a strategy. It's hard to follow through. You can't evaluate on your own what's working, what's not working, where to go next, right? Like, and I think that it can go back to, again, that piece of like, you deserve to have a circle of care. It sucks that you have to build the village yourself. Maybe you don't have to build it yourself, but you have to initiate building it. Get that done. And like, ideally you do that when you're pregnant or before you're pregnant, or just like in general, because like this could apply to people who don't have children and have anxiety and depression and mental health issues too, right? It's just that the experience of the biological and emotional experience of having a child just rips a Band-Aid off. So like, you know, it's being ready for that, and then having those supports set up for yourself, knowing that there are lots of different ways to get better. You can get better.
This is great. This is a good place, I think, to stop. Where can people find you? I'm going to put links to your Instagram in the show notes. Where
you can come see my blurty Instagram.
All of those stories.
At Niki the Naturopath. That's Niki the Naturopath. My website is www.nikithenaturopath.com. I'm on Facebook as well, rarely, but people can reach out. They can chime in, and thanks for having me, Talia. It was a great convo. I knew it would be.
Yeah, it's so, and I'll just like add some pressure for you, but you mentioned that you had a project coming up. It's still in the creation phase.
Right.
Now maybe you have to do it because we're going to talk about it, but
I'm going to have to do it now. Good one. I am in the process of developing a little pilot project called Basic Bitch, which is, sorry, I swear a lot in case you're going to notice that on Instagram. And it's like a little group program where people can learn how to take care of themselves. It is geared towards people who are in early parenthood or about to go into parenthood. And the idea is that we learn how to take care of our babies and our children, but we don't learn how to take care of ourselves. So it's basically just translating what you're learning about taking care of your baby or kids into how to take care of to yourself in really like simple, pragmatic ways. It's learning the basics so that because that's where we have to start, right? That's where we can start. And sometimes the structure of the basics are enough. And that's also a big piece of that also is developing that community as medicine piece, because I really feel like building the community, I really want to help people build the community, because I think that that's something that is of great value. Was of great value to me, and I think it will help other people too. So I'm hoping to start that. I guess I will have to light a fire here in early April. That will be happening.
Yeah,
so people can reach out to me. I think you can get my email.
Like the working subtitle might be Basic Bitch is the main title. Subtitle, when you're 42 and learning to chew.
Yes, it was inspired by my friend Jane, who learned how to chew at 42.
Which many of us
I still don't know how to chew. Her digestion and all the things. Because we forget, right?
Whole pieces of food and then wonder why you're bloated. That's my problem.
And we need to getting back to the basics too for people during those times of struggle can be really helpful. It's like prune it back, right? Just get down to what helps, and like we'll probably be, maybe you can come on and talk about blood sugar, Talia. That would be great.
So
I know you're the or magnesium, because you're my favorite mag hag too.
Mag hag and blood sugar. I was like that could be like you can definitely put like some blood sugar quote on my tombstone. I'd be totally okay with that.
For real.
I always joke, like I was actually thinking, because I make this joke a lot of like, if it was in the drinking water, and then I'll just like make this explicit, because part of me is like, so many health problems are because we put stuff in drinking water. So I don't want when we started like fortifying stuff and like adding stuff to drinking water. So no.
Yes.
Until, it's always a null hypothesis.
Yes.
But until disproven, I'm pretty sure a lot of us need our blood sugar balanced, and seems to be in this day and age that adding more protein is helpful. So
yes. And that's definitely, it's definitely one of the basic bitch concepts for sure.
Mm-hmm. Yeah. Blood sugar and chewing.
And sleep and water and movement. And we're gonna
all the basic concepts.
I'm gonna try and keep it somewhat on track, because as you can see, I have a lot to say. I always have. In grade 2, my grade 2 teacher, who was a cruel woman, but she gave me my full name is Nikki Jean, and so she used to call me Nikki Jean the talking machine. And I'm pretty sure she's dead now, but I'm kind of like, guess you were right, Mrs. Mason. I'm gonna own that. Okay. I'm gonna own that.
I mean, you're like, well, one day, just watch me, Miss Mason. One day it's gonna be how I make a living.
One day there will be these things called podcasts.
Wasn't it like that thing where there's like a meme going around where it was like your teacher, when you're like, why don't you learn how to do math? And your teacher's like, well, because you're not gonna have a calculator on you wherever you go. and then it like shows a cell phone.
Exactly. Exactly.
So,
oh my God.
You're like, there will be something. If there isn't, I will invent it called a podcast where people listen to me talk for 3 hours at a time.
Exactly.
They're gonna love it.
They're gonna love it. Okay.
Okay, Niki, thank you
right.
so much.
Cheers. Thank you.
Bye.
Bye.